AIDA can bring lots of value to developing a comprehensive Aboriginal and Torres Strait Islander health research agenda. We have over 180 Indigenous doctors graduated across the country. It's actually about getting our clinicians to bring their cultural understanding, working with communities to make sure that we actually address the questions that communities want to know around their own health and how to actually make improvements in that regard.
Aboriginal people have always been researchers. You don't survive for 80,000 years in this country without really knowing where the right foods were, how to understand the cycles of nature. In terms of medical research and health and medical research in particular, I think Aboriginal people haven't been involved as much as we would like in the past 20 or 30 years. We are starting to see a change in that phenomena, and many of the people who are leading that work are Aboriginal health professionals, doctors, nurses and allied health practitioners.
The most important thing is that we need to make sure we're doing the right thing by our community and by our people. The way we get that correct information is by doing research. By doing research, we know that we're not just saying what we say is right, we have evidence or proof that what we're doing is right. The most important part of that is the history of our research in Aboriginal and Torres Strait Islander Australia has been very poor. A lot of our communities feel like they've been guinea pigs, if you like, rather than actually being looked at in a scientific manner. And I think by making sure we do the right processes, ultimately we want to get what we call the correct translational research. That means whatever we learn from research, we can actually communicate that to our community. When we communicate to the community, the outcomes are good. And at the end of the day, what we want is our people to be good and healthy, and that's the most important thing.
Increasingly, we're getting more community involvement with research and communities who are actually identifying research priorities. But it's also no longer just a one-size-fits-all approach, so that we are more mindful of the fact that what works in a white Anglo-Saxon male is not necessarily going to work in an Aboriginal female.
Increasingly over the last 5 or 6 years, we've seen AIDA play a much stronger role in setting policy agendas, informing the way in which government seeks to engage with Aboriginal organisations and supporting the Aboriginal community control sector in health and social services more broadly.
Our research agenda will help improve health outcomes in Aboriginal and Torres Strait Islander communities generally by actually addressing the heart of the question. We've heard from the Research Forum that Aboriginal people suffer from chronic heart disease, and one of the reasons behind that is actually because they've got broken hearts due to social and emotional wellbeing outcomes. And that's not a question that the average clinician would actually ask unless they bring an Aboriginal and Torres Strait Islander cultural lens to that question.